This podcast is for informational and educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Patients in need of medical advice should consult with their personal healthcare provider. From UPMC Children's Hospital of Pittsburgh, welcome to That's Pediatrics. I'm Brian Martin, Vice President of Medical Affairs here at UPMC Children's.
And I'm Amanda Pahalik, Assistant Professor of Pediatrics at Children's Hospital of Pittsburgh.
We'd like to welcome Dr. Anna Ettinger today. She is a Senior Research Scientist at the University of Pittsburgh School of Medicine, Department of Pediatrics, located within the Division of Adolescent and Young Adult Medicine. We are really proud of Dr. Ettinger's work, and she's working on something called the Pittsburgh Study and the Family Strength Survey. It's a survey of how caregivers have supported their children and family support in general during COVID-19. Welcome, Dr. Ettinger.
Thank you so much. So great to be here remotely joining you today.
Yeah, I think we should acknowledge the weird. This is generally something we do in one room. But on a Microsoft Teams platform here, it's a little different. Can you tell us, much like, as is evidenced by our environment for our podcast today, can you speak a little bit about what brought you in your role as a research scientist specifically to our Department of Pediatrics, and a little bit about how your work, how maybe your history influenced your work with the Pittsburgh Study and Family Strength Survey?
Yeah, I'd be happy to. So I always knew I wanted to go into child health and do something to help mothers and children. Wasn't sure exactly what. So after I graduated undergrad, I did a year of AmeriCorps with the National AIDS Fund in Washington, D.C., and worked with homeless women with HIV/AIDS and their children. And that was really a life-changing experience for me. It got me to see the profound effects that socioeconomic factors and racial disparities have on women and children's health. And so it really pushed me to focus on prevention and research to see how I could help inform policy and practices. So I decided to pursue dual degrees in public health and social work focused on social justice. And then I did additional doctoral work at the Department of Population, Family, and Reproductive Health at Johns Hopkins, focused on early child health, specifically how social and family factors influence child health outcomes. So I did research on maternal depression and family and parenting, on child growth. And then I worked for several years as a senior scientist at Booz Allen Hamilton, which is a federal health consulting firm doing mixed method evaluations of different federal health programs. And I also there had the opportunity to work on the National Children's Study at the National Institutes of Child Health and Human Development, which was designed to be a longitudinal study of child health and environmental influences on health outcomes. So that gave me a lot of really great experience, even though it was canceled after a while, but I was able to bring that to the Pittsburgh Study. We actually moved from DC to Pittsburgh more for family reasons. I had 2 kids and then found out I was having twins. So with 4 kids, we decided we needed some family support, and my husband's from Pittsburgh and I'm from State College. So this was a good place to come and raise our family. And then luckily I heard about the Pittsburgh Study and the opportunity to influence children and youth in Allegheny County, and knew I wanted to be involved. So about almost 2 years ago, joined Dr. Miller's team in Division of Adolescent and Young Adult Medicine.
Cool. I think that's a really great intro. I know a little bit about the Pittsburgh Study and some of the things that they've been doing. I'm really curious to hear about some of the things that you guys have pivoted towards, given the recent pandemic with COVID-19. I can't imagine that wouldn't have had a major impact in sort of some of the study's interests and goals, and hoping that you can comment a little bit about that.
Yeah, absolutely. So as you know, the Pittsburgh Study is this large multi-cohort and community-partnered intervention study that we've been working on and planning, and spans from pregnancy through adolescence, and really is aimed to focus on thriving and kids succeeding rather than a specific illness. And we had started, some of the cohorts had started collecting data when COVID hit, and then that obviously changed how the studies were going to do their interventions and collect data. And we also, kind of at the same time that COVID and the stay-at-home order hit Allegheny County and, schools were closed, we started hearing from a lot of our community partners that they were in crisis and, parents didn't have food for their kids or diapers for their babies. And what were we doing? Because we were supposed to be this community partner and committed to equity. And so we needed to do something. So in addition to kind of direct volunteer work and delivering supplies, we met with a lot of our community partners, including Allegheny County Health Department and the Department of Human Services and United Way, to ask them what type of information would be helpful to them as they develop their response. And so we launched then the Family Strength Survey that you alluded to in the beginning, which was a weekly online survey that started in April and ran for the next 6 months. We just recently switched it to be a monthly survey, but it's completed online. We had more people participating in the beginning, but about 300 participants, caregivers, who were either pregnant or had kids up to age 18 in their household anywhere in Western PA could participate in the survey. And we asked about kind of core questions every week on child thriving. So the domains that we had identified through our Pittsburgh Study work on the importance of, keeping your kids, meeting their basic needs in terms of food and housing, but also, keeping them healthy and happy and able to learn during the pandemic. We asked about parents' own well-being, and then asked about what programs and services they have been using, what's been working, what do they need more of, including, if it's food or housing or employment, so all kinds of like the social determinants of health. And so having those key questions every week, we're able to track over time how families were doing, what were the gaps, and then because of the nature of this to be a rapid response, data to action type of project, we submitted those reports to our partners and put our weekly results online on our website. And then we also adapted the questions throughout the pandemic as as COVID evolved and our response evolved, or we went through the different phases and schools opened and closed. So we were able to adapt questions based on what families were writing in terms of some of the challenges. They added challenges about online learning. So we asked about access to technology and devices. And there was comments about COVID testing and concerns about being able to, barriers in terms of not having a primary care provider or not having insurance. And so we, sharing that with the Allegheny County Health Department, they really wanted to get the word out that that should not be a barrier. You don't need a PCP. Anyone who needs a test can get it. So, I think it's been effective in that way in getting the word out about different kind of challenges that families have been facing. And then we also developed a series of topic sheets and infographics to make the data more accessible for our community organizations to use. Every week, families would also write in strategies that they've been doing that are helpful and beneficial, or particularly like websites that they've used, such as yoga or meditation websites that have been good resources, or family centers within Allegheny County that have been particularly helpful. And so we developed a resource page that families can go to look at based on those suggestions.
That's fantastic description of really, I think, a ton of work. And one of the things that struck me early when I was learning about the Family Strength Survey from your group and Dr. Miller, and the reason I say it struck me was it was launched with a positive focus, right? I hear a lot about bright spotting specifically, and as a very different way to approach social determinants of health, and in some of the opportunities we have as a health system to help patients and families with some of the building blocks of good health. And maybe that's how we address food insecurity, how we address maybe access to testing during COVID, how we address behavioral health or mental health things with it, but just take it from the beginning and to think of it as a strength survey versus a weaknesses survey, I thought was pretty cool. Can you speak a little bit about specifically where you think this might be going. We're fortunate to have the just for the listeners to know, a robust kind of community health division here at Children's Hospital of Pittsburgh, where we have family, they're called family care connection centers, or really they're centers that the hospital, outposts that the hospital has out in different communities to assist families with some of the things regarding raising children, for example. I mean, there's everything from parenting classes and CPR classes to food resources, housing resources, safety resources. Can you speak a little bit about maybe some of the early findings of the study and how that, in addition to you spoke a bit about the yoga and some of the wellness things, but like where do you see this kind of going, and how can we continue to take this work and really advance it on the intervention side? So if you're pitching me as a hospital administrator, I guess I'm asking, what can I do for you and the insights that you've gleaned?
Yeah, and thank you for bringing up the strengths focus of it. I mean, I feel like when I give the reports, I tend to focus on kind of the challenges, and when people write in, some of the stories are heartbreaking, and obviously we can't discount the hardships that people are going through, but we always make sure we balance that with positive questions. We ask about family resilience, like how are families solving problems and working together and relationships. And, for the most part, most families say that their kids are safe and loved. And, while there are challenges, there are strengths to build on. And so I guess, just one of your questions was about kind of early findings and how we were able to adapt them. And then I'll move into kind of where I think we could go with this. So, food assistance was and has been and continues to be one of the top needs of families. And early on, a lot of work was done to help, give out food at schools and food banks. And those things are easy to access, we think. But then we were getting people writing in that they're a single mom and they don't want to bring their 4 kids because they don't want to expose them, or they work all day. And then there's the hours of the food bank is closed. So, we reported that to United Way, and they were able to offer some home delivery services that, weren't there before, to kind of reduce those barriers. And so I think providing that context to the services that are being offered is really important. And right now, again, we've heard it early on, but it continues, and I think is going to be a continuing problem, is mental health and unmet mental health needs and the stress of just the ongoing pandemic. And so, about a third of families are reporting that they can't. Only a third are reporting that they can completely meet their child's social and emotional needs, and only 20% of parents say they can meet their own needs. And so we've asked additional questions about barriers to mental health care, and try to say there's these telehealth services, people, this is a primarily insured population that's participating. So it's not as much as insurance, but, are they aware of the services that are available? And, we've heard from comments that telehealth is just not the same. Their daughter refuses to do it online, or their provider wants to meet them first and they don't feel comfortable going in. And so I think there's still some barriers there that, we need to address, whether it's through public health messaging or tailoring services, or, doing some kind of creative in-person counseling that's, distant. So I think continuing to just get those stories, bringing the voices up is really important. We are continuing to meet with Allegheny County Health Department and Department of Human Services, and we just had a meeting with Allies for Children, which is a group doing a lot of advocacy work. And they're releasing a monthly newsletter that we are, hoping to support. And so we were brainstorming that this morning as well, what can we do with this data? And so we talked about coming up with a child health equity report for the area, highlighting some of this, because we also had Trying Together there, who, there is some big concerns around childcare and access to childcare as school districts continue to be closed for families who are trying to work. Childcare providers have been able to extend to provide school-age children with more care, but they're not getting reimbursed enough to kind of, they don't have the capacity to keep that up, and they're losing providers. So it's they're struggling with funding to keep that going, while parents are struggling, with continuing to work while their kids are home from school. And then, you mentioned bright spotting as well. And I think that's something that we can also do with this data in terms of looking at areas that are doing well, trying to figure out what are the strategies that they are implementing that could potentially be used in other areas.
It's really important. And, and I think that one of the things that I really love about this is that you have, this is really provided kind of like real time or really pretty close to real time insight through a historically unprecedented event. I mean, it's been 100 years since we've had an event like this in the United States, and I think that I know, for a fact that we have drawn upon this, and your group have been very generous with the data and with the results and with the insights. And that, I think, combined with some of the community partnerships we have, allow us to develop tactics and modify them. And rather than have them be based upon hypothesis or maybe assumption, we've really used this work to say, okay, it's directly from the people we serve. Again, it sort of can't be a crisper or more pure way to know how we can best take the temperature of their needs and then work together to try to address them. It's good stuff.
Yeah. If I can jump off there, Brian, I'm curious about how much you've been able to utilize this data that you've gathered, which I think is so critical. And work with groups outside of our area, because I'm sure a lot of the information that you're gathering is not specific to Allegheny County. I'm sure some of it is, but has there been any opportunities for you to work with other groups in other regions, share that kind of information, share information about resources that may be more national or state level beyond just our little area, and then how has that been able to sort of both push your family strength survey forward as well as help other similar types of groups move or launch their own type of surveys?
Yeah, that's a great question. So we've done, we're working to publish the data. We have one brief report that's been published or is in press for academic pediatrics, and there, the comments we got back on the initial draft was, how is this relevant outside of Allegheny County, outside of COVID too, that this is a model, like a academic community partnership that, you were able to pivot quickly and launch this response to this public health crisis, it's something that can be replicated and is, generalizable to other areas. And the findings that we, were reporting around kind of the disparities in how the social needs were, based on race and ethnicity and income, the different groups were experiencing different hardship. That's obviously what's been found nationally as well. We have another manuscript focused on dental needs, because that was, the biggest unmet health need was around dental care. Families, so the missing immunizations and missing other pediatric visits was important, but dental needs was 3 times as high. And so, getting that information out as well, I think will be important. So, now that we're switched to monthly, I think we have more time to analyze this data and work on it to get the kind of those results out there that might be helpful to other groups. We have had requests from outside researchers interested in our questions. We've shared our survey. We've replied to different grant opportunities with a couple of different organizations who are interested. A lot of the questions we've used are validated measures. So, for example, from the National Survey in Children's Health, or the NIH toolkit has social determinants there. And so, hopefully that we can use the results to national benchmarks to compare those. But I think, that's a great idea, Amanda, to do more of that, working with outside groups outside of Pennsylvania, outside of Allegheny County, even outside the state as well.
It just feels like this has so much more to give than even just our area, right? So it would be great to see that.
Yeah, absolutely. And I can tell you, we've had a little taste of this. Some of this work has been shared with our solutions for our National Children's Hospital Association group, and also our solutions for patient safety, which is a national group related to some of our community health and community health research efforts during COVID. I think we have. I mean, this is something where obviously we really welcome and thank you for your time today, on this podcast, and I think a lot of other hospitals and health systems and agencies and nonprofits we can share this with them and really amplify your work and really kind of spread the seeds, if you will, of really good work that started here in Pittsburgh.
Mm-hmm. Yeah, that would be fantastic. And I just want to, I would be remiss if I didn't recognize, all our community partners who've helped, worked with their communities to complete the survey, have worked to, distribute it, and continue to be our partner with the Pittsburgh Study. And I think that's really what has made it so successful here. So I thank all our partners for that. And definitely thank you for your time today.
Absolutely. Well, thank you very much.
Thank you.
We wish you a great day.
Thank you. Bye-bye.
You can find other episodes of That's Pediatrics on iTunes, Google Play Music, and YouTube. Please be sure to subscribe to keep up with our new content. Leave a review and tell us what other topics you might like to hear about. And thank you again for listening.